Good morning and welcome to this morning's webinar. My name is Daryl Moon and I'll be your host today. This is the 7th webinar in our series of short 30-minute webinars on the best practices of managing population mental health. Brought to you by goingonoffense.com and sponsored by Resilience Pro. Recordings of each of our previous webinars are available on the goingonoffense.com website. So the pandemic has certainly heightened the need to address mental health. The uncertainty that we all face is having devastating effects on emotional well-being. We started up this movement back in March or April as an attempt to go on offense and support people who are struggling, and to really not just hold back and say, well, we hope everybody's okay, but to take a very proactive approach to addressing emotional well-being. And we've recorded over 30 different webinars on multiple topics. About a month ago, we started this specific series focused on lessons we've learned by managing population mental health for over 20 years. I've had the privilege of being a part of an organization that has taken a very different approach to managing mental health. It's sort of a pure ACO, accountable care organization type environment, where we took the financial risk and profits came from keeping people healthy versus just increasing the cost every year. So the focus was, how do you intervene early, address emotional well-being proactively to reduce the cost? The fewer people that need hospitalizations, the less it costs. It's been a very successful endeavor and very enjoyable for me to be a part of that. And based on the need now more than ever to address emotional well-being, we decided to share the lessons learned through this, what we call an abundance strategy. In other words, instead of restricting access to care, how do we proactively get people the help they need when they need it, as soon as they need it, and abundantly provide services? And we've proven that that's a very effective strategy. So these webinars that we're doing each week are to really share best practices we've learned through that abundance strategy. So far, we've addressed in the series topics such as integrating mental and physical health, overcoming the stigma barrier of mental health, technology that monitors the emotional well-being of populations. So a true preventive maintenance program can be implemented to maintain optimal mental health. Another topic is how to attract and retain top talent through supporting emotional well-being. Filling the holes left by many EAPs. Last week, we focused on proactive emotional health and measurement-based care. Today, our topic is the role of technology and mental health apps. I'm honored to have as my guest today my friend Michael Rouse, CEO of X2 AI. I met Michael a few years ago when he was just starting up his company. Michael has created an artificial intelligence mental health chatbot with the name of Tess. Tess was built by clinical psychologists, and it coaches people through tough times to build resilience by having text message conversations similar to texting a friend or a coach. I'd like to give Michael a chance to introduce himself and the emotional health support technology he's built to help people who are struggling. Michael, tell us a little bit about yourself and your program.
Thank you, Daryl. That was a wonderful introduction. So originally I'm from the Netherlands, in Europe, where, kind of similar to how you were saying, ACOs are basically the norm, not the exception. And that was always kind of my thinking with regards to healthcare, of we should make sure that people get as much access as needed. And there's simply a wide spectrum of people and their needs. Some people really directly need to talk to a PhD psychologist, and they should. Other people might be in a more preventative state where some things might be going wrong. They might just have had a bad interaction, but it's easy to get them back on track and to really work on their resilience. So that's really where we started thinking, like, how can we reach all of those people who might need some extra resilience training or some light coaching? And it's perhaps at first look a bit strange to then look at a robot to help out with that. But I'll tell you why I thought that was a good idea. And luckily it turned out to be a good idea. It was because I myself was a patient once upon a time. And afterwards I became a peer support counselor. So I was just basically, it felt like me that I was repeating my therapy and the things I learned in therapy and taught them to my peers. And as you can imagine, there's lots of repetition in explaining those things. And that happens to be something computers are very good at, repetition and seeing patterns. So in that way, it was actually possible to create this chatbot that is able to chat back and forth and make people feel better. And the first step was to really show that in randomized controlled trials in really research settings at big health systems. And then slowly but surely, we saw the light and we realized, oh, employers really care about their employees. They really want to make sure that if they can do one extra thing for their people, they will. And in that way, we put this product in the market to make it very affordable to reach out to everyone and to chat with everyone and to proactively pull people in and then to figure out the triage. If it turns out they need something more, they get a counselor on the line, for example. And like you said, we've been growing pretty fast. Nowadays, we cover over 19 million people, and this doesn't only include employers anymore, but we also help sort of affinity associations, like, for example, ARP Foundation, where we support seniors with social isolation, and also groups like United Way. And in that way, we can also make sure that the free benefits that they offer are also offered to all the other people we help.
Nice.
So that's me in a nutshell.
Michael, before I go into some questions that I've got for you, let me just mention to our attendees that we would encourage them to send in questions. We'll try to take the first 15, 20 minutes and just have a discussion, but then if you've got questions, please share those with us by sending those to your control box. So let's talk just a little bit about how TESS does that in terms of engaging people in additional mental health support. It's very much an initial triage, but tell me a little bit about how TESS does the role of engaging people who need more care than what TESS can offer.
Yeah, the main key thing is just to reach out to people. So there have been a couple of studies showing, for example, at EY, that they had the How Are You campaign, where they just sent an email to every employee asking, how are you? And they were just dumbfounded by the amount of replies that they got and emails back and like almost cries for help as well. And then they realized, well, how are we going to get all the counselors in place or coaches to actually help them? So very similar to that, we do the same thing. We either, when we work with the employer, we might get a list of phone numbers and we just send one helpful text message. And that might be as brief as, how are you doing? Or it might be more custom, like, oh, it's getting towards end of tax season. I know you've been working very long hours. If you might be struggling, that's totally fine. I want you to know your employer cares about you. So if you need anything, I'm here to chat. And those are really ways to just reach out to people and just to get the conversation going. Perhaps it stays with just psychoeducation, or maybe we switch to triage, or we might actually do some coaching on the go.
For those that have never had the experience of interacting with a computer and texting back and forth, and many of us have through some of the chat features that companies offer where you're first interacting just with the computer. But talk a little bit about that interaction with TESS and sort of how does TESS tee up a person to start sharing what's concerning them?
Yeah, that's a very good question. And what we are seeing is, especially with a big part of the population with regards to the employers or EAPs whom we work with, is that their employees are spending a lot of time on social media. And in that way, we can really reach them in a customized way, where on social media, the employee might see a little promotion coming by in their timeline on Facebook, for example. And there they might, in that way, see something that says feeling stressed or something a little more. And that's really the first trigger for someone to say, like, didn't really reflect on that lately, but let me say chat now. Let's see what happens. And then in the first message, it says, hi there, I'm Tess. I'm a mental health supportive chatbot, and I'm here to talk with you. Would you like to learn more? And then the person will text back, sure. And then we'll give the privacy policy, which includes all of the exact rules and things we abide to with regards to HIPAA and privacy. And then the person will say, okay, that sounds good. And then we have basically two tracks. One track that jumps right into it. So if we ask, do you want to talk about an acute issue that stresses you out now, or do you just want to learn to get to know yourself better? And then basically people go down these two tracks. Either then the next question is, okay, so how are you doing? And then we try to figure out, well, will we give them a deep breathing exercise? Will we recommend them to go for a walk? Will we maybe talk through their problem? Then we just let people vent. And then, yeah, in that way, really, you can really think of it as self-reflection as well in that way.
Nice. And I remember you sharing with me that you built this with one of the largest computers out there that really allows you to apply artificial intelligence. Talk a little bit about the power of artificial intelligence.
Yeah. First you start off with a very big and smart computer, and then you need the data. And the data is surprisingly hard to find. People don't necessarily post their therapy sessions online. And so in that way, we really had to gain the trust of every single person to slowly get them to open up. And the miraculous thing that we found out is that people actually find it easier to open up to a robot than to a person. Because if we tell them properly about the privacy policy, about how their data is protected, they feel safe. And they feel like it's not that my data is going to be out there on the streets, but also it's not like someone is going to be there on the other side of the line who might be having a good day or a bad day and might be showing that they might have some judgment of the things I'm opening up about. But instead, it's a very, every single message is written by a psychologist and reviewed by other psychologists. And we really make sure that it's an empathic conversation. So if someone says, I really messed up today, I got into an argument with a coworker, then Tess would say, oh, I'm so sorry to hear that. That happens to everyone. Let's talk about it. So it does sound very emotional, but that's really because that's the language the psychologist put in, and not necessarily because the robot itself is emotional itself.
That makes sense. And is the computer, the robot, whatever we want to call it, is it always learning to where it can be even more effective? And if so, how does that work? Is it just a number of algorithms that are sending people into different trees, or is it actually learning as it goes?
Yeah, so very important concept that I coined is AI on a leash, which just like with your dog, it's on a leash. We make sure that it learns at the right times in an appropriate way. So sometimes with these AI systems, it can become unpredictable what they will learn, and then they will have just learned something in another conversation and then try to apply it in the next, but it might not have been the clinically sound thing to apply. And in that way, we always make sure that if the system has learning, that's great, but then it first gets tested by our own psychologist and first gets vetted and say like, yes, these are solid things, this makes sense, let's do this. And in that way, we really always ensure that it really sticks to very high quality standards.
Makes sense. You know, you mentioned a little earlier that people actually are sometimes more willing to open up to a robot than they are to a live person. Talk a little bit about that. I think there's probably a lot of truth to that.
Yeah, so that's really fun. Like, so Tess, that's the name of our robot. When people chat with her, they very quickly start saying she and her. So that's a very interesting process, which is kind of similar like back in the days when people grew up, they might have had a favorite toy animal, and they would also not say it, but they would say he or him or her. And yeah, in that way, really people kind of take it one step further, because it's a very nice conversational partner. And in that way, it's also just that people basically they realize that when you're chatting, you actually don't notice the difference too much than when you're chatting with a person. It's just when as soon as people put on avatars and they have a robot avatar talking to someone, then it will look weird because it will move too slowly, or it will just come across bad. Or on a phone call as well, like the systems are just too slow right now. We do have a version that you can talk to, and it's on Google Home, but it's for seniors. And they very much appreciate that it's so slow, because it's like, oh, finally, someone who takes the time to listen to me and who takes the time to slowly pronounce what they want to say.
Interesting. Interesting. So talk a little bit about, is it just literally texting with SMS texting, or are you jumping into an environment that's different than just texting back and forth? Tell me a little bit more about the technology.
Yeah, we make sure we really reach the member where they are at. So if they are already spending a lot of time on social media, then we make sure that we can do this chat conversation on that same social media platform. If an employer, for example, a meat packing factory we work with, for them, it's very clear that people don't necessarily have smartphones or internet plans. So for them, it's better to use SMS texting. So in that way, we make sure that it's just SMS texting, and we give them a toll-free number, so they don't have to worry about the cost. And for some employers, they have a custom version, so they white label it and make it part of their app, and they just embed our chat window in their app. So it looks exactly the same as their app. It's just that the one chat window is connected to our server, and the messages are being sent back and forth.
I was going to ask you if TESS is built into any of the mental health apps. Are you saying that it's employers who have already kind of put together something that are adding it? Are there any mental health apps that have just included TESS as a part of their standard package?
Yeah, certainly. So there's several employers, and we'd be happy to connect people to those employers for references, but we of course have to stick to NDAs. Also, we attached a brochure, I believe, to this meeting that gives a couple of examples of different employers. And also, there's an app in the App Store called PHQ Depression Test, and that's an app we've partnered with. That's a general app that's freely available to anyone. It's by a partner at Deloitte who has developed it and made it available for free. And that app, our chat is also part of. So after you do the screening, you could access it there as well.
Nice. Well, and I'm going to repeat what you just said. There are some handouts available right now for those that are attending, if you'd like to download those through your control box. One is a great study that's been done and published in the Employee Assistance Journal, I believe. In fact, let's talk a little bit about some of the research that has been done to confirm the effectiveness of TESS. Michael, tell a little bit about some of the research that's been done. There's actually been a number of studies that have come out where they've analyzed the effectiveness of this chatbot.
Yeah, so we've been busy. We started actually out as a research firm. So naturally, we started doing many research studies when we started getting our first users. And in that way, we've now done 7 studies. And they're all published and peer reviewed, and they've all been carried out by external universities, and several randomized controlled trials to really hone in on what's the effective dose that people are getting here. And the results we found in those studies is that we're able, when we use the PHQ-9 and the GAD-7, we're able to decrease symptoms by 23 to 28% for depression and anxiety.
Nice. That's got to be rewarding for you as the founder of TESS with this idea. How long ago did these ideas and concepts come to you as something you wanted to pursue?
Yeah, for me personally, the idea popped into my head when I just started the peer support counseling. So that must have been now about 11 years ago. Okay. And then afterwards, slowly, indeed, it was always looking forward to that first research study that would tell me if I'm crazy or somewhat sane. And yeah, no, that's been very rewarding. And one thing I believe is very important is replication studies. So we've done several replication studies to really show that that effect is real. And also we've shown it to be real in Spanish. So the system is also available in Spanish, and there we see the same effect. And for example, with Rochester Institute of Technology, we did a study really focusing on suicide prevention. So basically, people often ask like, oh, but isn't that a danger? Isn't that a liability? If someone might be suicidal, they're chatting with your system, but they should be chatting to a coach or a counselor. And that's very true. They should be chatting to a crisis counselor. But the fact is that at that point in time, the crisis counselor did not know that they were suicidal, was not able to reach out to them. So in that way, we're really the first line of defense, sort of like the crisis responder, pre-crisis responder, to really suss out, okay, who are the people that are at very high risk that should right away talk to a crisis responder, and who are the people that can be put at a different point in the queue, but we still keep a very close eye on them, and we have a crisis counselor just monitor the conversation to just make sure it goes the right direction.
Nice. Well, and this whole concept of, well, first of all, statistics show that people will wait often 10 years after mental health symptoms appear before they get help. And so, this whole idea of early intervention and proactive reaching out to people is sort of the key. Shortening that time where people feel comfortable, and TESS is one of those applications. It doesn't take the place of other mental health resources and services, but it can play an important role at getting people to start the conversation. Because as you mentioned, there might be some judgment, or fear of judgment on the other side. And so a computer doesn't have judgment. I may feel safer talking to a computer, and then the computer can play that role of, bringing in or helping me overcome the hurdle of actually getting the help that I need. Talk a little bit about the human factor, because obviously a computer isn't going to have that rapport building capability. I mean, people do care that someone else cares. There's no question, which is a big part of what a counselor or a coach does. But technology, as I see it, can play a role at getting them to that personal care and compassion. Tell us a little bit about your thoughts.
Yeah, exactly. Yeah, that's really what I believe in, is the best of both worlds. So the part where the technology shines is very scalable, very affordable, able to reach out to everyone. And then the part where traditional care shines is, once we know exactly who's a good fit for traditional care, then we should get them connected as soon as possible. And in that way, we really see, like you were saying, like people opening up. A very simple way we measure how people are opening up in the chats with TESS is we just count the amount of words. In the beginning, usually people say, okay, sure, maybe, yeah. But slowly they start saying, well, my husband this, that, and that, and that. And then we slowly see them opening up more and more. And only at that point will we try and intercept and say like, oh, did you know that there's actually a counselor available to you? Did you know you have 5 coaching sessions? And so at that point, it's also not awkward for the person, because they will probably feel ready for it. And at that point, it's a high chance that they will say yes. And then we can even match that up with the availability of the counselors, either through online scheduling or to really see like, oh, someone's session got canceled, so they're available for half an hour. And then we can send out those requests to fill up that slot, basically.
Is there a real person always kind of in waiting for someone who might show symptoms of high risk or severe mental health, symptoms? Is there always someone who can step in, or is it kind of based on availability?
It's based on statistics. So there's always someone, and then based on the statistics, it depends how many. So for a very large employer, we probably have more people available on standby. For a very tiny employer, they might be sharing one person with a couple of other tiny employers. And then that one person will make sure that if for anyone there's a need, they will jump in. And in that way, we can really scale that up as much as possible. Like we have partners whom we work with who had networks of counselors. One partner has 300 counselors and they're all in a call center. So they're really on demand. They pick up the phone right away. They can de-escalate. Another partner has 5,000 counselors, but they're all over the United States, and people can pay for them with invoice billing or reimburse or cash or reimbursement.
Right. Nice. So would you consider TESS to be part of the mental health app industry, or would you keep it kind of separate from that industry?
Yeah, that's a fine line. I've managed to walk many years, and yeah, in the end, it's definitely part of the mental health app industry. And what we really try is to make sure we find the best partners. So for us, we're able to white label test as well. So for us, it's not about, oh, like you said, like it's complementary. Like it's not like, oh, we need to try and replace some other app, but it's more like, well, we can help triage. If people want an app where they see lots of visuals and they see lots of videos, then that might make sense that we like kind of promote them to go and install that app. But there's often, when the employee population, even if the employer or the EAP offers an app, there's often a part of the population that just says, I don't want to install an app. I just want to chat whenever I need something. And it would be great if someone replies right away and I don't have to call into a call center. So in that way, we also kind of help with, sometimes with call centers, the intakes are a lot of work. We can help out there as well, where they can do the intake via chat, so that it's easier both on the provider, but also on the member who wants quick access to relevant answers to their questions.
Nice. So we only have a couple minutes left. I did want to share some information about the mental health app industry in closing. There's about 10,000 mental health smartphone apps. That's a lot. According to the Journal of Current Psychiatry in March of 2018, so it's been a couple of years, their comment was the rapid rise of these apps is partly due to their potential to transform a patient's smartphone into a monitoring and therapeutic platform capable of capturing mental health symptoms in real time and delivering on-the-go therapy. For example, researchers who examined, however, let me just say that there have been some apps that have been found to be maybe even dangerous or harmful. So there's a lot of apps that are out there that don't have a lot of research. One research showed out of 700 mindfulness apps on iTunes and Google Play stores, only 4% provided acceptable mindfulness training and education. They go on to say that some apps can be harmful or dangerous. There are early studies that have demonstrated that there are apps that are effective for many different conditions, including schizophrenia, depression, anxiety disorders, suicidal ideation. I know one of the apps that our partner has partnered up with is a company called Impact Suite. They have 4 different apps. One's for depression, anxiety, one's for substance abuse, one's for sexual compulsivity, one's for personal wellness. I spoke just a few days ago with the CEO of Super Better, which is in a randomized controlled trial at the University of Pennsylvania and clinical trial at the University of Ohio State. Playing Super Better improved 7 pathways to higher resilience, including optimism, self-efficacy, perceived social support, life satisfaction, less anxiety, fewer symptoms of depression, and less hopelessness. Another app that I'm familiar with and spoke to a number of the people is called Evermind. It's a stress reduction app put out by Alpha Health, a division of Telefonica, one of the largest telephone operators in the mobile network industry in the world. All of their content is grounded in evidence-based techniques with cognitive behavioral therapy, mindfulness, meditation, positive psychology, and curated by their team of behavioral experts. They're actually one of the supporters of this movement called goingonoffense.com. So We're about out of time, but I wanted to give Michael just kind of anything that maybe you want to share about TESS or your company that you didn't get a chance to, and just tell you thanks. So any closing remarks, Michael?
Yeah, one important thing is that I totally forgot to mention is that we also have a foundation. So next to our for-profit work, we have a foundation, and we've especially seen us being able to make a way bigger impact since the COVID-19 crisis. So we actually allow people to donate money if they are able to, and if they are not, then they get free access. So in that way, we've now, over the past 3 or 4 months, we've managed to help 120,000 people who all were not able to afford regular care, or they weren't able to afford our product through an employer. So in that way, we managed to reach out to them and give this to them for free. And I think with that also, there's one other piece we didn't talk about, kind of the different topics people talk about. And it's very, concerning to see that, especially in these times of when people are in shelter in place, that the topic of domestic violence has gone up a lot. So we've had to create custom content to help with that. And in general, also, what other things people might not expect is, for example, postpartum depression is also a topic we help a lot with, because it's also like very high stigma, and in that way makes it easier for people at least to open up about it, and at least to learn a few things about it. So, and if people want to try out our services, you can of course do so at our website, x2ai.com, and you can request a demo and we'll give you access, and you can really get to know and experience it yourself.
I appreciate that. In fact, it wasn't until you gave me the chance to experience that I really could wrap my head around this idea. And I must say, I support it. It's a great idea. So compliments to you. Thank you again for participating today. In closing, let me just say that Resilience Pro is the sponsor of this series on mental health best practices. There is a brochure that's available to download through your control box describing the services of Resilience Pro. Next week's webinar in this series will be on ensuring prompt access to the right mental health provider. Tina Halliday, licensed clinician and manager of UniBHN, will be joining me as my guest panelist. Tina's been managing the case management and provider network aspects of our innovative mental health solution for about 20 years. You won't want to miss next week's webinar. We'll be discussing some of the most invaluable lessons we've learned over the last 23 years in managing population mental health. With that, we'll sign off. Thank you again, Michael, and we wish everyone a healthy and a wonderful day.